welcome to Ideal Spine Health Center. And let's give Dawn a round of applause. She's the one who set this whole thing up, so thank you to Dawn for getting this set up, right? We love doing talks like this in the community. So I'm Dr. Pascal, and I'm one of the doctors here at Ideal Spine Health Center. And we're part of a large network of doctors called CBP, or Chiropractic Biophysics. And as part of our goal with CBP is to boldly step out into the community and help educate small groups like yourself and in different businesses and teach people about true healthcare. Because our system up to now has only really focused on what we call sick care or reactive care, right? You guys will probably be aware, we don't really go to the doctor to be proactive. We usually wait till there's a problem. We wait till there's a crisis or there's a sickness, and we go address that sickness with usually drugs and surgery, and oftentimes it's too late. And so we take a different approach to healthcare. We come in as healthcare, proactive healthcare. So what I hope to achieve tonight is to change your mindset a little bit and maybe set you on a different path and change what you really consider to be healthcare so that you might make some different choices leaving here today to be proactive about your health and really hopefully avoid being in that end range crisis situation where oftentimes a lot of decisions have to be made out of anger, fear, because it's really late in the game. Does that make sense? And so I'll talk a little bit about what we do here in our clinic, but June is Scoliosis Awareness Month, right? And today's June 1st, and we got a lot of kids in here. And so we're really going to talk about scoliosis, and we're going to dive into what scoliosis is and how it can be either one, prevented, or worked on, okay? So here's a little bit of information about scoliosis. Let's move forward here. First off, does anybody know, have we all heard of what scoliosis is? One more time, let's try this again. There we go. Okay, let's see if this will work. So let's let that think for a second, and we'll talk about scoliosis. So, does everybody know what scoliosis is? If you do know, go ahead and show me your hand. Lift your hand up for me. Okay, so most of us know what scoliosis is. Let's see if this is going to work. So scoliosis is when the spine, it should be straight from the front. Okay? Scoliosis is what happens when you have any more than a 10-degree curvature of your spine, and it has a component of rotation. Okay? So your spine is no longer straight from the front. It has a curvature, and it has a form of rotation. Now, a lot of people associate scoliosis with teenagers. Right? If you think of scoliosis, do you not typically think of a young teenager? Would you guys agree with that? Well, really, scoliosis affects people from infants all the way into their golden years, or even right up until death, right? You can see scoliosis in people of all ages. The reason we typically associate it with young adults is because when a female hits about 10, 11, 12, that's when she really hits her biggest growth spurt. And boys, it's usually 13, 14, 15. Now, up until 10, 11, 12 for females, they're really growing from the hips down, guys. So it's the legs that grow. So even if they have a small curvature in the spine, the legs are growing, and it doesn't really become pronounced. But it's in that age range of 10, 11, 12 for females where they start growing in the torso that if there's any curvature in there, it's really become visible because they're growing and it becomes pronounced. Does that make sense? But it doesn't only affect young teenagers, it affects everybody. It just becomes pronounced in young females from 10 to 12, and young males between 13, 14, and 15 years old is typically when we see it most. Now, 80% of the cases for teenagers, not for everybody, but for teenagers, 80% of the time, the scoliosis is considered to be idiopathic. You guys heard that word before? Idiopathic scoliosis? No? Here's the best part. You know what that really means? As medical professionals, we're idiots because we don't know what's causing it, right? So idiopathic means no one's actually figured out the cause of why it's happening. The other 20% of the time, sometimes it's a neurological disorder. It can be a bone problem. Aha, thank you, Amanda. So when you have a nice straight spine like this, that's a normal, healthy spine. When the spine gets curved like that with rotation, there's your scoliosis. And 80% of the time in teenagers, again, it's idiopathic, meaning we don't know why it's there or what's causing it there. 20% of the time it's because a bone is malformed. There might have been a large accident, a fracture, things like that, okay? Now, infants can also have scoliosis, really young infants. And when infants have scoliosis, it can cause a lot of problems, and it can even cause premature death. So it's really important to get little kids screened as well, because if they have curvature of the spine, it's really important to get that checked at a young age. If the scoliosis persists into them being juveniles, 70% of, let's say, 5, 6, 7, 8, 9, 10, those curves will continue to progress till they get to adolescence, and they will continue to develop and progress and have problems moving forward. So even infants and juveniles should also be checked for these different problems. Does that make sense to everybody? Now here's what most people don't know. There's actually a higher percentage of people that reach their 60s who have scoliosis than you would know. 30% of people who reach 60 have scoliosis or develop scoliosis. By the time you get to 90, it's 60% of the population that has degenerative scoliosis. Because if you have any underlying misalignments of your spine, we call those subluxations. It doesn't necessarily have to be a full-blown scoliosis. Those minor misalignments of the bones that stay there over time cause postural problems. And those postural problems, as you get into those later years and your ligaments and muscles and bones begin to collapse, you develop something called a degenerative scoliosis. So when you reach that late menopause for females or early 60s for males, those curves can degenerate at 3 degrees per year. So even for the elderly, it's quite important to get checked. Because let's say someone does have a 15-degree curve at 60, if it progresses at 3 degrees a year over 10 years, now all of a sudden by the time they're 70, they have a 45-degree degenerating curve. That leads to pain, disability, all kinds of different health problems, right? Well, that really brings me to my next point. Well, why would it be important to have that straight spine? Has anybody heard before, if you had, you could put your hand up, that your brain controls all the functions of the body? Have you heard that before? If you have, put your hand up. Good. So we have a lot of people who have heard that before. So your body functions by having this guy right here, your brain. It sends messages down that spine, because inside there runs your spinal cord. And that communication goes down the spinal cord, and it'll leave all the little nerves of your body, and it controls every single cell, tissue, and organ in your body. Just like you guys know how to chew right now, right? You don't really have to think about it, you're just chewing. Well, that's controlled by your brain. How does your digestive system know that it should start breaking down that food and using it for energy, right? All of those processes are controlled by your nervous system, and AKA your brain. So your spine is that main communication pathway for all the vital functions in your body. So when our spine breaks down, different things can happen. One, of course, you can end up with pain, degeneration, and different disabilities. But you can also end up with asthma, allergies, acid reflux, bladder problems, colon problems, right? Because all of those nerves are going through your spine, and as you start to kink the spine and contort those nerves, you're basically blocking that important communication, that life energy from getting to your brain to the organs. Does everybody follow me on that one? So that's why it's really important to find these problems in their infancy. Now here's the last thing I'm going to tell you about scoliosis till we move on and talk about how do we find these problems. Where it becomes really tricky for an adolescent is that 20-degree cutoff. Because let's just say, and this would be over a 20-degree curve, if that person had a 20-degree curve, at that point when the child or the adolescent grows, those curves are going to get exponentially worse. That means that instead of progressing like this, they go like this. And that's a principle called, this is a fancy word, I'm going to make you guys repeat this after, it's called Reuter-Volkmann principle. Does everybody want to try and say that with me? Reuter-Volkmann principle. Perfect. You guys are naturals. So the Reuter-Volkmann principle says that if a curve is 20 degrees or more, like right here, the sides of the bones that are being compressed, those growth plates, or the bones that grow, stop growing. And the other side, because it's being stretched, is going to be an increased growth. So if you have a large growth spurt in your torso and there's a curvature in there, the curve is just going to grow in magnitude and get exponentially worse because of the way those growth plates are being affected. Does that make sense? So it's really important to find those curvatures when they're under 20 degrees because it's the easiest time to fix them, and you can really prevent a really large abnormal problem from developing. Is everybody with me so far? All right, so now that we know a little bit about scoliosis, let's move on and talk about what do we do to find out if someone has scoliosis. So a lot of you, I understand a lot of you are part of a homeschool group, is that correct? Right, so you might not go to the typical schooling program where they have nurses who check for scoliosis, but in different avenues throughout childhood, a lot of programs are going to try and check for scoliosis and look for these different indications in a child's body that they may have a spinal problem. Now, here's where we run into a problem. Our typical healthcare system says if the curve is between 0 and 20 degrees, no big deal. Let's just watch it and wait for it to get bad enough to do something. The reactive healthcare model, right? So you might find a scoliosis. It could be 18 degrees, right on that cusp of becoming a significant problem, and they'll say, hey, you're not 20 degrees yet? No big deal. Why don't you come back in a year and see us, and we'll see if it's bad enough to do anything about it at that time. You guys think that's a good approach? No or no? No, right? Terrible idea. Because what happens if the child gets to 20 degrees and they hit a growth spurt, they can go from 20 to 40 within a year. Now you're talking about surgery. Because between 20 and 40 degree curves is what our typical healthcare system says we should put a brace. And it's not a brace that actually does anything to correct. The braces that we put people in are typical braces, just hold you in a straight neutral position. They don't do anything to fix the problem. They're just trying to prevent it from getting worse. And then if you get to 40 degrees and it is worse, then it's time to contemplate putting rods, surgery in the back, right? So you guys can see how if we don't do something early on and you let it progress rapidly, there can be much larger consequences for the child, the adolescent, moving forward and having to get a permanent surgery. Does that make sense? So knowing that information, first off, let's see. If you agree that a straight spine would be healthier than a curved spine, put your hand up. Okay, so we're all on the same page there. Very good. Now, if you knew someone in your family had scoliosis or yourself had any sort of postural problem and spinal issue, would you want to get it corrected under 20 degrees or over 20 degrees? What would you guys say? You could shout your answer. Under. All right. Right? So we're all on the same page, right? If it's under, you got a better success, there's better outcome if we can correct and catch those curves early, and we all agree that a straight spine is going to be healthier than a crooked spine. Yet, our current healthcare professionals, the ones who create our politics and healthcare, say we shouldn't do anything between 0 and 20 degrees, and that's where our opinion differs because we know a lot can be done in those early curves. We can totally fix the problem, straighten up a spine, and you have no more risk of scoliosis for your life. Wouldn't that be a much better outcome, guys? Right? Absolutely. Yeah. So I'm glad we're all on the same page there. So let's just say we do a screening, we find someone has scoliosis. In our office, we would do an exam, certain tests, we would do some x-rays. We would find out if you have a spinal problem, not only scoliosis, any sort of spinal deformity, postural problems, right? They all come down to a lot of the same principles. We take an x-ray, and can you guys all see that curvature in that young lady's spine? So she came in recently, and she had a 27-degree curvature in that mid to low back area. So she has a fairly significant scoliosis. She's right on the cusp of being, she could do a brace if she wanted. She's choosing to do care in our office. So we want to ensure that we can get proper results and straighten out her spine. So with this young lady, we did something called a stress x-ray or correction potential, meaning we stressed her abnormal curve into a neutral position. Can you guys see how nice and straight that is? Pretty awesome, huh? 27-degree curve down to a 3-degree curve. She has great potential to be corrected. So a lot of times, depending on the severity of the problem, but most of the time, we're going to go ahead and take these types of stress x-rays to see how well can we actually fix the problem for the person before we do our recommendations for care. Does that make sense? It gives us a bit of security to know that we can actually make these changes and help the person achieve that sort of long-lasting correction. Oh, and one more thing, just so you guys know, if someone in your family does have scoliosis, there is a genetic link. So even though we don't know what causes it, there is a proponent or a component that comes from genetics. So if you have a sister or a sibling, you want to get most of your children checked. If you have a mother, father, anybody that has scoliosis, get everybody else in the family checked because there is at least a 30% chance that the sibling is also going to have spinal curvatures and spinal problems, okay? So what do we do in our office if we do find scoliosis? We do everything in what we call mirror image. Here's the best way for me to describe it, so just don't pay attention to this. You guys all look at me. Let's say someone has a problem where they shift to the right, they bend to the left, and rotate right. Well, we're going to do everything, adjustments, exercise, and traction, rotating to the left, shifting to the left, and then bending to the right. We do it in the exact opposite motion. We overcorrect the spine so that when it rebounds, it recoils closer to neutral. That's really what sets CBP and our techniques apart, is that we do something called mirror image, adjusting, traction, and exercise. And that's what you're seeing examples of there are different traction setups and exercises for people that have scoliosis or those types of spinal problems, right? Because scoliosis, this is just a picture of our facility here, and that's actually right behind you guys here on this shaded glass. So scoliosis, not only is it a problem with the bones, the ligaments, and the muscles, we also actually have to treat the brain. Because you have to understand that your brain, again, we talked as the master control, right? So it's controlling those muscles that are weaker on one side, hyperactive on the other side. It has a lot of these different abnormal patterns coming from your brain, causing you to have these different muscle contractions holding you in this position. So a lot of what we do with scoliosis patients too is actually what we call neurological rehab, teaching you proper exercises so that we can train those muscles to hold you in that nice, healthy position, again, for those long-lasting results, okay? The last thing that we do with the patient, if the patient is a candidate for a brace, we do something called a scoliosis brace. Now, this is not your typical brace that you would get if you go to the orthopedic surgeon or you go to the medical doctor. Those are called TLSO braces, or Boston brace, Milwaukee braces. They're those different braces that kind of wrap around the hips. They might be like a leather corset. Sometimes they have these neck pieces that come up. And those braces don't cause any correction. They only try and straighten the patient up to a neutral position. Well, we know with scoliosis, if we don't actually reverse and push you the opposite direction, you're not going to get any long-lasting correction or change. So this brace is called a 3D. It does exactly what we do with our treatments. It puts the patient, if they're like this, into the opposite position, and it holds them there for 23 hours a day. So activating the underactive muscles, stretching out the tightened ligaments, and putting pressure on those bones for the Reuter-Volkmann principle, right? So that they can grow and they can continue to get sustaining correction throughout the entire day. So that's really the difference between our bracing and the standard conventional bracing. And this can be worn under a t-shirt. I've never worn one myself, so I won't comment on it. We can ask other people if it's comfortable to wear for 23 hours a day. All right, so here's an example of pre-post. After we do treatment with a patient, we always re-x-ray afterwards to see, did we actually cause any correction? We want to know, are you feeling better? Are your symptoms decreasing? Those are all great things. But we also want to know, did we actually create a change? And I know it's hard for you guys to see, but this young lady here, she had a 33.9 degree curve, and after treatment, 17.1. It's not perfect, you know, but decreasing it by 50%, this was a high-risk curve that was now down to a moderate risk curve. It doesn't mean she was done treatment, but she was feeling significantly better, and overall, she's in a much better, healthier position now moving forward. Ultimately, we'd keep going and try and get that curve down as low or as small as possible for the longest lasting benefits, right? Does that make sense to everybody? So, when I say chiropractor, most people automatically think neck pain and back pain. Would you guys agree? That's kind of the conception that chiropractic, we are neck pain and back pain specialists. And as a matter of fact, as a whole in our profession, we get great results with neck pain, back pain, and we do the same here in this office. But someone that's looking for a quick fix, you know, hey doc, my back just hurts, pop my back and send me on my way. Someone that has a pessimistic attitude regarding health and they're not looking out preventatively, proactively, that's not the right patient for this office, and we're not good with that. You know, we can help people with pain, but we're not about the quick fix. We're about helping people with these long-term, overall global health problems. Like some of our specialties are stress and sleep-related disorders, postural deformities, scoliosis problems. Those are some of the things that we specialize on here in our office, right? And as part of our campaign, our awareness of trying to change your thinking, I mean, I can make you guys aware about these things, but what really changes people's lives is pushing them from awareness into action. A lot of people know that smoking is bad for them, but they can't quit, right? They can't take that action. So for being here today, we want to offer you guys the opportunity to get checked out in our facility and find out about your individual health needs, your possibilities, find out what's going on with you as an individual to see if there's something that we might be able to help you with to help you on your path to achieving that better health. So typically our initial consult, exam, x-rays, and the second visit to review the results of all of those tests can range up to $250. But if you guys want to sign up today, we're going to do that at our cost as a thank you to you for being here and a thank you to Dawn for setting this up for you guys so you guys can take the opportunity to find out what might be going on with your health, okay? But really there's two things that stand in the way of you and proactive better health. The first one is money, and we just took that obstacle away by doing that at our time. The second one, pardon me, on our dime, the second one is procrastination, because procrastination really is the thief of health, guys. And that's the reason that when you walk out today, the offer no longer applies. I can't help you in any other way or shape or form than just try and help you get into action, okay? So if you're serious and you want to find out what might be going on with your health or your kids' health and you meant what you said about getting started early, take advantage. Kayla and Cassie, you guys want to wave your arms, you guys can look around. They're going to be at the front desk, and then we have enough times scheduled or reserved for you guys to be able to sign up for an exam consultation to find out if there might be some sort of problem going on with your spine, okay? If you want to sign up someone that's not here, like a spouse, a friend, a family member, that's fine. We've reserved more than enough times for you guys to be able to all get checked out within the next 2 weeks. If you have any personal questions for me, I'll come up here. I don't like answering personal questions in a group setting for individual privacy and HIPAA rules. So if you have personal questions, come see me up here. If you want to sign up for the appointment and take advantage of that opportunity, you guys can go see Cassie and Kayla at the front desk. If you're not ready to commit to a full exam yet, that's fine. Dr. Justin and Michelle, they're in the back. They can wave their arms as well. They're actually going to do a quick scoliosis screening. So they're going to have you bend forward, look for any rib pumping, take 2 posture pictures, and if we see any postural abnormalities, then we are going to send you up to the front and get you signed up for a full exam, okay? So you have 3 possibilities right now. You can come ask me personal questions, you can go straight to the front to see Cassie and Kayla to sign up for a complimentary exam, or you can see Dr. Justin and Michelle in the exam rooms there at the front as well to do a posture and scoliosis screening, okay? So I hope the lunch was good. I hope you guys learned something and this was of value. Okay, I thank you very much for being here, and I'm done talking, so thank you very much.